students. Congratulations on your acceptance to the MSW program at Cleveland State University. In this presentation, I am going to help you learn about some content to help you fill out your intent to enroll form. So hi, I'm Patricia Stoddard-Dare. I'm the MSW coordinator at CSU. So congratulations on your acceptance. CSU is an excellent choice. It's an economical choice. We have top-notch professors of diverse environment. We have a new state-of-the-art curriculum. We have a flexible schedule of classes, family and work-friendly options for completing your degree, access to quality resources to prepare for the licensure exam, and CSU is a top-rated school for social mobility. On your intent to enroll form, you'll notice that there are some boxes that you need to check. You need to indicate when you're going to begin taking classes, your desired specialization, your preference for the time of when you take classes, either daytime, evening only, or late evening, and Saturdays or online, and your preference for full-time, accelerated part-time, or extended part-time. In this presentation, I'm going to give you an overview of what all of that means so that you can make an informed decision. So the Advanced Standing MSW program is 36 credits. It can be completed in 1 year full-time, 1.5 years accelerated part-time, or 2 years extended part-time. Students in the Advanced Standing program complete one 2-semester practicum in the fall and spring semesters. It's a total of 500 hours, and students should reserve 15 to 17 hours per week to complete their practicum. Students start the Advanced Standing program by taking Social Work 501 and Social Work 508 in the summer of 2018, and then they proceed to complete a 30-credit specialization. If you are a student who is graduating in August, then please contact the MSW program coordinator, that's me, so that we can talk about what your schedule needs to look like. We offer 2 specializations at Cleveland State, the clinical or the advanced generalist. The clinical specialization helps train students to be mental health counselors. Students will develop skills to be competent in the practice of psychotherapy. They'll learn how to complete behavioral and mental health assessments. They learn how to provide treatment for individuals, couples, families, and groups. They're prepared to work with a range of clients in diverse types of settings. And this is a trauma-informed curriculum, so they are prepared to work with trauma survivors. The clinical specialization classes include psychopathology, a clinical practicum, core competencies for social work clinical practice, trauma and recovery, clinical social work practice with groups, interventions for clinical social work practice, evaluation of clinical practice, another practicum, a practice in context class, and an elective. Now let's talk about what the Advanced Generalist Specialization is. The Advanced Generalist Specialization is preparing students for a multi-level or multi-system practice. Students who are Advanced Generalist practitioners are prepared to assess and intervene with individuals, families, groups, organizations, and communities. They develop competencies for practice that prepare them to take the Advanced Generalist exam for the Ohio LASW license. Social workers with an advanced generalist, multi-dimensional skill set work in hospitals and nursing homes, rehab, child welfare, settlement houses, and in many other service settings. It would be wonderful if you would like, you can contact your CSU advisor to talk about the difference between the clinical or the advanced generalist specialization so that you can make a choice that's best for you. Because you're in the Advanced Standing program, you do have to choose your specialization at this time. So if you want to meet with your advisor, that would be wonderful. We'd be happy to talk to you about your different options. I do want to let you know that there's no right or wrong answer. Both specializations will prepare students for the LISW licensure exam. The advanced generalist classes include advanced generalist group work practice, an advanced generalist practicum, social work as leader and manager, advanced generalist practice with individuals and families, another advanced generalist practicum, program evaluation, advanced generalist practice with communities, 2 practice and context classes, and an elective. And I'll talk about the practice and context classes in a minute. You'll see that there's a notation next to some of these classes. These particular classes meet only in the evenings between 4 and 9:50 p.m. So currently those are evening only classes. So I just wanted to make sure that you knew that. The other classes are not, that are part of the advanced generalist. Those might have other options like online or even during the day. Both clinical and advanced generalist students will be taking practice and context classes. These courses allow students to experience specific practice settings. And here's a list of our current practice and context classes. Here you can see that they cover topics from addiction to mental health, aging, family and children, healthcare, military, trauma, child welfare, death, and human sexuality. You have 3 options for completing your MSW degree. The first option is the full-time. So if you choose to be a full-time student, you'll begin by taking ethics and diversity in the summer, and then you'll take 4 classes plus a practicum in the fall and spring. You'll complete the program in 1 year, which is 3 semesters. Your specialization classes, which are your fall and spring classes, will meet on Tuesdays and Thursdays. And if you're a clinical student, you could take those classes during the day or during the evening. Evening is from 4 to 9:50 p.m. or in the late evening, Saturday or online. So the late evening would be 7 to 9:50 p.m. Saturdays would be Saturday mornings or early afternoon, or there might be an online section. So we ask students to choose to either take classes during the day, during the evening, or that late evening Saturday or online. Some students who are taking day or evening classes are also interested in taking online classes. We give the preference for the online classes to those who are in the late evening Saturday group, but if there's space available, then we make room for those online classes to the day and evening students as well. So if you register early, that's usually not a problem. Advanced generalist classes are evening only, as indicated in that previous slide that I showed you. These are the classes that are evening only. Okay, so this is what the full-time clinical schedule looks like. It starts by taking the ethics and diversity in the summer, then 4 classes plus a practicum in the fall, and 4 classes plus a practicum in the spring. If students wanted to, they could opt to take these 2 classes that have an asterisk in the following summer. This is the schedule for the full-time advanced generalist curriculum, which is similar, starting with 2 classes in the summer, and then 4 classes plus a practicum in the fall and spring, with 2 classes that students could take in the following summer if they wanted to. A second option for completing classes is the extended part-time option. Students start by taking 2 classes in the summer, then they take 2 classes in the fall and spring of their first year, and they take 2 classes plus a practicum in the fall and spring of their second year. And then they complete the program in 2 years. Fall and spring classes meet on Tuesdays and Thursdays, and for clinical students, they can take those classes day, evening, or the late evening Saturday online option, and then advanced generalist classes are evening only with some online. So this is what the schedule looks like for those extended part-time classes. Starts by taking that ethics and diversity in this summer, and then taking 2 classes in the fall and spring of the first year, and then taking 2 classes plus a practicum in the fall and spring of the second year. And then the classes for the extended part-time advanced generalists follow a similar format where you take 2 classes the first summer, 2 classes in the fall and spring of the first year, and then 2 classes plus a practicum in the fall and spring of the second year. The final option is the accelerated part-time option. This allows students to complete the MSW program in 1.5 years. Clinical students can take their fall spring classes during the day, evening, or the late evening Saturday online option. And then the advanced generalist classes are evening only with some online, as I've discussed previously. This is what the accelerated part-time clinical schedule looks like. Students start by taking 2 classes in the summer, then they take 2 classes plus a practicum in the fall and spring of the first year, then they take 2 classes the following summer, and 2 classes the following fall. And then here you can see a similar schedule for the accelerated part-time advanced generalist, starting with 2 classes in the summer, 2 classes plus a practicum in the fall and spring, 2 classes in the summer, 2 classes in the fall. I do want to let you know that the summers follow a unique schedule. But the Tuesday, in the first year here, the classes are on Tuesdays, and then here in the next fall here, classes would be on Thursdays. So you can plan your life and your education with reliability. Every class will be offered during a particular semester, on a particular day of the week, and at a particular time. So for example, all in-person specialization classes are offered on Tuesdays and Thursdays, or online, with some sections being offered on Saturdays. So during in terms of timing of classes, during the fall and spring, every required clinical class will be offered during both the day and the evening, or some classes are online. Day classes take place between 8:30 and 3:25 p.m., and evening classes take place between 4 p.m. and 9:50 p.m. To accommodate full-time working professionals, required clinical classes offered in the evening from 4 to 6:50 p.m. have a mirror section that's offered either online or on Saturdays between 8 a.m. and 1:50 p.m. This is the late evening Saturday online option. As I mentioned previously, advanced generalist classes are evening only from 4 to 9:50 p.m. or are online. Summer classes are unique and do not follow the general day-evening time schedules. Most summer classes are 6 weeks long and are offered either online or in person after 6 p.m. 2 days a week, either Monday, Wednesday, or Tuesday, Thursday. So, you should be prepared now to complete your intent to enroll form. All students who are graduating in May, who are accepted to the Advanced Standing Program, should be starting in May, so you could check that off here. If you believe that there's a reason why you're not able to start in May, then please contact me as soon as possible. You should be prepared now to check what is your desired specialization, either clinical or advanced generalist, and you should please indicate your preference for the time you would like to take your classes. Day only, which is between 8:30 and 3:15, evening only, which is between 4 p.m. and 9:50 p.m., or late evening, which is from 7 to 9:50 p.m., and Saturdays or online. As I mentioned previously, online classes may be open to students who are daytime only or evening only, but preference does go to the late evening Saturday students first. But if you register early, then we try our best to accommodate your preferences. We also would ask you to indicate your cohort, whether you would like to take classes full-time, accelerated part-time, or extended part-time. It's been great chatting with you. Please contact your advisor if you have any questions.